Today I'll be talking about psychotic depression, how it presents, what it causes, and how to treat it. My name is Dr. Air, psychiatrist and lifestyle medicine physician. Major depressive disorder, commonly referred to as depression or unipolar depression, is a mental disorder. This condition presents with depressed mood or loss of interest or pleasure. It also presents with several other symptoms that can affect your energy levels, motivation, sleep, appetite, and ability to concentrate. In some cases, it may even make you experience thoughts of harming yourself. These symptoms can affect your ability to function normally at work, school, socially, and in relationships. To estimate the severity of depression, we usually look at the level of functioning. As such, depression can be divided into three categories: mild, moderate, and severe. Someone may always feel sad and tired, lacking interest in things, but still show up at work and get along with life. This will be a case of mild depression. On the other hand, someone who cannot pull themselves out of bed, does not show up for work for days, and is unable to function despite the consequences of this may have severe depression. I once treated a middle-aged woman who showed up feeling very sad and tearful for the last 3 months. She could barely keep up with caring for her 2 kids and had lost interest in all her hobbies. Taking care of her personal hygiene had become a huge chore. She would often go for days without showering or brushing her teeth. She was sleeping excessively as she was always exhausted. She had also lost a lot of weight as she had no appetite. She felt hopeless and worthless. In addition to these symptoms, she also had psychosis. She had psychotic depression. In this case, her proper diagnosis was major depressive disorder with mood-congruent psychotic features. I'll explain this further, but before I do that, it is important to point out that depression is a serious illness. When depression presents with psychosis, it is even more concerning because it is likely to present with more severe symptoms and a greater risk of self-harm or thoughts of suicide. So, what is psychosis? Psychosis refers to a loss of reality due to severe impairment in thoughts and emotions. It can also occur in other mental conditions like schizophrenia, schizoaffective disorder, bipolar disorder, and delusional disorder. Psychosis results in hallucinations, delusions, or both. Hallucinations are sensory experiences that appear real but are created by your mind. It can cause you to see, hear, feel, smell, or even taste things that are not real. Delusions, on the other hand, are fixed, false beliefs that conflict with reality. They are firmly held despite proof and evidence that this is not the case, and even though members of the culture do not share the belief. There are different types of delusions. Examples include persecutory delusions, grandiose delusions, delusions of control, delusions of reference, delusions of poverty, delusions of self-accusations, and delusions of infidelity, sometimes called pathological jealousy. Psychosis can be very frightening and distressing, not just to the person struggling with them, but also to those around them. Studies show that about 15 to 20% of people with major depression exhibit psychosis, which means they have hallucinations or delusions, and in some cases both. In psychotic depression, delusions tend to be more common than hallucinations though. Psychotic depression is also more common in older people. So what causes psychotic depression? Well, this is not fully understood. We do know, however, that there is no single cause. Genetics play a large part as severe depression can run in families. A family history of psychosis and bipolar disorder also increases the risk for psychotic depression. Life events and personal circumstances can trigger or precipitate this illness in people with a genetic predisposition. Such situations may include relationship problems, severe trauma, and grief. Experts separate major depressive disorder with psychosis into 2 categories. 1. Major depressive disorder with mood-congruent psychotic features. In this type, the hallucinations and delusions reflect the emotions and feelings that show up with depression. Examples of such emotions are guilt, worthlessness, personal inadequacy, deserved punishment, and fears about physical disease or death. Hallucinations may include hearing voices that are derogatory or suicidal. 2. Major depressive disorder with mood incongruent psychotic features. In this case, the hallucinations and delusions conflict with emotions related to depression. Examples are hearing voices praising you, believing you have special powers, or that you can control other people's minds. In psychotic depression, delusions tend to be more common than hallucinations. In the case of the middle-aged woman I talked about earlier, she experienced severe depression with delusions. She believed her internal organs were rotting away and described herself as a walking dead. She had several doctor appointments and tests as she complained about all sorts of symptoms, which she attributed to her body organs slowly decaying. With the proper medications and treatment, her depression and psychosis improved remarkably. So how is psychotic depression treated? Treatment involves a combination of antidepressants and antipsychotics. Examples of antidepressants are sertraline, fluoxetine, and mirtazapine. Examples of antipsychotics include aripiprazole, quetiapine, and cariprazine. Other treatment options include esketamine or Spravato and transcranial magnetic stimulation or TMS. It is also important to consider therapy as a treatment modality. In severe cases, electroconvulsive therapy or ECT may be necessary. In a later video, I'll go into more detail about the various treatment options for psychotic depression. Thanks for listening, and please let me know in the comments what your experiences are, what has worked for you and what hasn't. I'll speak with you soon.